So now it's my pleasure to introduce again Dr. Rini. He's going to talk about the opposite. What do we do when we rest? What do we do when we heal overnight? And how does the glymphatic system help our brain restore its normal function? Dr. Rini?
Thank you, David. Good job. All right. Thank you, everyone, for staying awake. We're about to talk about sleep. For those of you who don't know me, my name is Dr. Rini. I'm a behavioral neurologist, section head of our cognitive program here. And today I want to talk a little bit about sleep, or more importantly, the overall concept of brain restoration and what that means. So usually when we talk about sleep, it becomes somewhat of a snooze fest. We talk about getting enough sleep, a certain amount of hours, don't drink, don't take that medication. And usually it falls on flat ears. People don't sort of take into consideration, what is this actually doing? Sleep is energy conservation. Life is governed by energy. The brain is the most expensive organ in the body. It takes nearly up to 40% of all your energy just to keep it running. And stimulation of that cortex of the brain, of sensory stimulation, if you don't give it time to restore itself sufficiently, all that electrical information, that chemical signals just turns into noise and it just becomes mush. You can't think. When restoration fails, the cost is accumulative. It isn't just that one day of just a little bit of brain fog. Enough days stacked on top of one another year after year, it begins to cause neurological injury. And today I want to sort of focus on just that. Now that said, a talk about sleep you can't move forward without, give it a second. Well, not working. We'll do it this way. Or not. There we go. All right, so human sleep is a cycle. We talk about sleep being on or off. That's not the case. It's all about cycles. And we're going to go into a little bit more detail on this, but generally when we talk about sleep talks, we talk about light sleep, deep sleep, and REM sleep. Light sleep, that's N1 and N2, that's a transition period. And then it's sort of not quite arousable, the brain's firing off the little spindles here and there. We talk about deep sleep when you're dead to the world, when your brain's not thinking, when you're not moving. We talk about REM when we're dreaming. Generally, there's a cycle that we all go through every single night. It's about a 90-minute cycle on average. That cycle starts at N1, sort of transition into a lighter sleep, deeper sleep, a little bit of REM, and then it goes back. So when people talk about how much sleep do I need, that's not really the focus that you should be having. It's like, how many cycles are you getting of this N1, N2, N3, N4 REM cycle? We should be getting around 4 to 6 cycles per night. Each of those cycles has different characteristics as the night progresses. Early night, cycle 1 and 2, that's usually a heavy N3 light sleep. N3 deep sleep. Middle night, that's usually a more heavy, lighter sleep. And by the end of the night, 1 to 4 a.m., 5 a.m., 6 a.m., that's when we're sort of dreaming. Now that said, that's all sort of very clinical and doesn't really apply much to how you think about information. The best way to understand that each of these parts of sleep, these stages of sleep, serves a very specific purpose. And how you understanding why that purpose exists in the first place helps you understand why you should be applying your life and your lifestyle towards getting good sleep. And the best way to do that is to understand it from an evolutionary perspective. So before there were cephalization, before there were centralized nervous systems, back when we were just basic jellyfish, there was still sleep. But it wasn't sleep in the sense that we typically think of it. Life is expensive, even without a brain. And early organisms had to evolve cycles of engagement, but then quiescence, calming down. And there was a rhythmic inactivity that exists well before central nervous systems even first emerged. This is basically the beginning of what you could say called proto-N1 sleep, where simple systems required periodic disengagement from their reality, and it allowed them to restore their simple nervous systems. So basically, N1 periodic disengagement results in prevention of depletion. But things got more complicated. We became cephalized. We had brains. We had early bony fish, early creatures with central nervous systems. And all of a sudden, you have this very complex nervous system taking in a lot of information and giving out more complex impulses, more motor changes. This requires a lot more complex on and off So you have to have a period of time where you're stopping, filtering information from the outside and be able to process it. This is when sleep spindles and gating first emerge. You have to be able to stop the outside world from coming in so you can think about it for a little bit, process what's important, get rid of the rest. For those in the physicians in the room, that's when sleep spindles emerge. Sleep spindles are these little rhythmic pulses that come from the center of the brain, the base of the brain called the thalamus. They create little pulses of plasticity where if something was extremely important that night, that day, it gets reinforced while the rest gets quiet. This is the first stage where we actually started having nervous systems that were storing long-term information relevant to survival. This is also the same period in evolution where orexin, which we'll talk about later, first developed. Orexin is a daytime stimulation hormone that is naturally secreted that makes us aware throughout the day, and is actually the inversion of this is one of the most commonly prescribed sleep aids. So this period of evolution where we had a process of N2 sleep, this sort of light sleep emerged, it emerged to decrease allow for complexity to be encoded into the nervous system by creating a low reactive state where you can actually fall asleep. So complex sensation requires stable deactivation time, N2. But then we went on land, things got even more complicated. Now all of a sudden we have this very complicated central nervous system, and we need to shut down for a long period of time to sort of take in that information of the day, process it, and be able to survive based upon it the next day. That's really a very vulnerable state to live in, i.e. you have to shut down and wait for the world to kill you. So animals don't want that. So they have to figure out how can we actually shut down in a controlled manner that allows us to still be able to react to predators. So what they figured out is that if we have cycle through these stages, where sometimes you're down, sometimes you're deep, sometimes you're down, sometimes you're deep, also you could still be a little bit aware of your environment, but still have enough time to actually disengage. Early reptiles, turtles, and some actually dolphins will actually shut off one side of their brain at a time so they can always have a semi-awareness of their world. But the point here is that you have to get into this N3 sleep and cycle in and out of it, which is the key thing here when things became increasingly cephalized. So again, deep restoration is only possible with deep sleep, but that deep sleep is impossible in a world that wants to eat you. So as a consequence, you have to cycle in and out of it. Things got even more complicated during the period before early mammals. Dinosaurs are what we still have around here, crocodiles and alligators, and the crocodiles if you go to this house. Brains all of a sudden started using this down period to start doing other things. So we talk about REM as being a mammalian thing, rapid eye movement associated with dream states, but actually early predators start to deploy this. Have you ever been on a raft tour, taking a look at a local alligator, and they're there, and they're quiet, and their eyes are slowly moving, and are they asleep or are they not asleep? They're in a very quiet period where they're not really spending much energy, but they're still hunting. This early proto-REM sleep started to emerge where this eye tracking was just grazing the environment, looking for something worth attacking, and then planning how should I attack that thing? That's when this early mechanism first started to evolve, why it existed in early proto-mammals and early proto-birds, which is why we share this with birds but almost no other lineage in the animal kingdom. So in the beginning, again, with this sleeping period, it was starting out as almost as a behavior to actually learn how to navigate, attack, and survive. But then we became mammals. We went underground. When we went underground, it's cold down there, so we had to become warm-blooded, endothermic. Now that endothermy, that spending of a lot of energy just to keep the body warm is extremely expensive. The brain's extremely expensive. So you have to go into even deeper states of sleep in order to maintain that alertness that would actually come from just natural heat. That said, in order to maintain natural heat before endothermy was fully developed, we had to huddle together in our tiny little burrows with similar creatures of our nature. Huddling together, getting warmth, well, guess what? Another animal moves, you wake up, you're not in deep sleep anymore. So you have to figure out ways to actually stay asleep despite all the stimulation of your fellow brethren. Oxytocin was actually evolved sort of around this time frame. Before that, it existed for a few countless millennia, but it wasn't used in the same purpose that mammals used it. Mammals used it as a soothing agent to calm themselves down around other people. It's most commonly associated with pregnancy as well as breastfeeding. The secretion of oxytocin generates a sensation of bonding and warmth and social habit, both in males and in females. And it's during this time that that slight touching in the evening calmed down the nervous system, despite the fact that with those little micro arousals. So that's when this N3 sleep began to sort of turn into like, how do we stay in a deep sleep in a safe environment, in a cold environment, in a dark environment? So cooler environments require deeper protected sleep and ways to calm the nervous system despite stimulation from other animals. Finally, we get into the more advanced mammalian kingdom, and that's when REM in its true sense really starts to fully emerge. This proto-REM behavior that we saw in early dinosaurs, early predators, actually becomes the actual dream state. And what are you doing in your dream? You're navigating an environment, imagining certain possibilities, acting on those possibilities, living out your day. REM is basically the brain is actively reliving experiences, trying to store information and process information. In order to do that, you have to reduce movement. So what happened is, as REM became more available, the ability to shut down the body became even stronger. So deeper sleep allowed for more complex brain activity to emerge, allowing for more complex thought. And it's this cycling between N1, N2, N3, and REM that allows the complicated human cephalon, the brain, to be able to function optimally. You need deep physiological recovery. We evolved this over the last 500 million years to protect energy balance, overactivity, safety, and processing. So what I want to get stressed here is that restoration is not passive, it is an active process. So how can you facilitate that active process? Again, what is this restoration on a neural level? What is neural reset? What is a physiological downshift when your blood pressure goes low and you cool down? What is environmental quieting when you don't need as much energy to get the job done? Most of this occurs in deep sleep. So how does it work? So all the time, when you're stimulated, the brain is firing and responding to information. When it gets into deep sleep, that activity begins to calm down. Your blood pressure goes low. You're not as stimulated. You have less dopamine, less norepinephrine. And with less norepinephrine, there's less firing, chaotic noise in the background. That's the little picture right there. What deep sleep helps is by decreasing that background noise, all of a sudden you get to have slow waves begin to emerge because the little fragments left and right not doing it anymore. We have more slowing. You're able to reset the overactive circuits so they don't burn themselves out. Deep sleep is not turning off the brain. It's turning to a quieter state where that random activity is not abruptive and it's basically overstimulating the cortex. So what is happening at the single neuron level? Well, this is when we talk about the glymphatic system. What's the glymphatic system? It sounds like the lymphatic system because that's essentially what it is, but it's for the brain. You have your arteries that are going in, your veins that are going out, and everything else that gets in there has to find a way out of the brain, otherwise it will swell. The glymphatic system is basically the sewer system of the brain. Whatever's been sort of brought up or pushed out of the cell that can't get back into the venous system has to get cleared. And that clearance happens the predominant time during deep sleep. That low adrenic tone, that low norepinephrine, dopamine, that actually decreases what's called astrocytes. Astrocytes are these little fat cells with little arm extensions that surround blood vessels. During the normal day, they're swollen because you want to make sure that nothing can get through those blood vessels. You don't want a virus or a bacteria or a fungus to take advantage of open blood vessels, so they surround and protect it. But then when you get to sleep, the presumption is that you're in a safe place, not being hunted, there are no viruses, no bacteria. So as a consequence, when there's less stress, less norepinephrine, they begin to decrease swelling. By decreasing swelling, that opens up space for fluid to move. If fluid can move, it gets drained into the glymphatic system. As a consequence, all that waste that built up over the day, whether or not that's plaque, amyloid plaque, tau, inflammatory signals, excessive chemical signals, all that can finally get out. And if it can't get out, it stays there all night long, causing problems. It's during this quiet state of deep sleep where low adrenaline and low norepinephrine, the brain's finally able to synchronize and allow for fluid to go out so you can repair yourself. That's why it's important. So what happens if you don't get that deep restorative sleep? You have a less efficient chemical reset. Neurons are always firing neurotransmitter from one neuron to another, and we think it just stays there. No, it drains around. You have to get rid of it, otherwise it's always quietly irritating the local cells. If you don't get deep, restful sleep, that neural background noise is still firing away. If you don't get deep, restful sleep, you can't replenish your cellular reserves of creatine, which we'll talk about in a little bit. And if you don't have deep, restful sleep, you can't clear out all those toxic proteins that Dr. Nelson referenced earlier today. Short-term effects, we've all felt it. I'm feeling it now. Brain fog, irritable, little worse in attention and mood. That's all right. It comes and goes. It happens to everyone. It's not a big issue. But if you stack it day after week, after month, after year, it causes damage to the nervous system, causes chronic fatigue, chronic mood issues, chronic cognitive impairment, and a higher risk for dementia, which is why, again, don't want to scare anyone. One bad night of sleep, not going to cause any issues. It's the long game, months and years that we're concerned about. Now, as we get older, that fragmented sleep, that sleep cycle becomes less efficient. As we get older, sleep becomes lighter, nighttime awakenings become more common, and as a consequence, deep sleep declines. What you see over here is a typical sleep study. As a young adult, you can see that curve down from REM down to deep sleep phase 4, stage 3, that goes back up and back down and back up. And over time, you can see most of the deep sleep is in the early part of the night. It gets less and less, but overall, you have a sufficient amount, that 20 to 25% time while asleep in that period. But as you get a little bit older, we're getting less and less of that deep restorative sleep, still staying that stage 2 in a REM cycle. So it doesn't matter, again, you're not really getting as much deep sleep. Now, deep sleep drops by 2% every decade around age 60. Total sleep begins to fragment and you lose about 10 minutes of deep sleep every decade. So wake time after falling asleep tends to rise with age. And as a consequence, to take away from the slide, aging reduces deep sleep if you don't do something about it. All right, so why do we get lack of deep sleep? Sometimes it's not just aging. I want to stress that, don't just blame it on age. There's a lot of medical reasons that can cause this. Chronic respiratory issues, COPD, asthma, or obstructive sleep apnea. Sometimes it's pain or irritation, restless leg syndrome, chronic pain of any sort. Sometimes we've just got to urinate. We got to wake up and then we can't get back down. We call it nocturia. Sometimes depression and anxiety are just sort of overstimulating the nervous system. You can never actually go into that deep restful sleep. Sometimes you're just never going outside. You're on your phone all day. And as a consequence, you don't have enough melatonin. You have a circadian rhythm problem. Again, there's a lot of reasons why this can cause. Most common in this highly pharmaceuticalized world, it's medication side effects. Benadryl, Prozac, Sudafed, there's a lot of things that can actually disturb sleep architecture, even the ones that are recommended to actually get sleep. Most common and treatable form of medical illness related to poor sleep or insomnia is obstructive sleep apnea. In the short term, it can cause decreased quality, daytime alertness, attention and mood. Long term, start increasing the risk for hypertension. It's one of the most common reasons for hypertension below the age of 40. Atrial fibrillation, the longer you age, depression, and increases the risk for dementia the older you get. So again, it's a treatable cause of cognitive impairment that if you address early has long-term ramifications. Now, the big question we all ask then is like, all right, so what's the risk of dementia, degeneration? Again, I want to stress this. It is not acute. Don't be afraid. One bad night's not going to cause any major issues. But if you have poor sleep for a long enough time frame, there is a slightly higher risk. As we have identified, Farmington's study showed that if you have less deep, restful sleep, there's a 25% higher risk of dementia as you get older. Sleep apnea has also a high risk. Some meta-analyses have showed upwards of 43% higher risk for a cognitive impairment non-specified. Now, the problem here is that, is it the sleep that's causing the degeneration, or is the degeneration causing the sleep? Again, in certain types of degenerative conditions, like Lewy body, like Parkinson's, can be more associated with insomnia or different types of sleeping disorders. So chicken or the egg, the answer is we don't know. But regardless, it should be a sign that something needs to be addressed. Treatment is promising. The strongest evidence for reducing long-term risk of cognitive impairment related to insomnia is treating obstructive sleep apnea, not just through controlling vascular risk factors, but also helping allow for glymphatic flow. DORAs, or dual orexin receptor antagonists, remember that orexin that we evolved in order to stay awake during the day? Well, guess what? If you suppress it, you get deep, restful sleep. You give it to a fish, and it'll happen just as well. Again, early promise that if you're getting deep, restful sleep with these agents, there might be some benefit long-term brain health by maintaining deep, restful sleep, but the evidence is still preliminary, but still very promising. Melatonin, again, there's very limited evidence for this. Some studies say, oh, there's a slightly decreased risk if you take a little bit. It's not strong enough for me to generally recommend. Some sleep specialists recommend like 1 milligram after the age of 65 every night, but that's because we secrete less as a whole. The answer here is that it's not very clearly defined in the literature yet. But I want to stress here that sleep is a warning sign, but also a modifiable risk factor for brain health. So what can you actually do? Sleep is the most powerful form of brain restoration, but it's not automatic. Restoration evolved to depend on timing, environment, physiology, and health. And if we want better brain function, we have to improve restoration. So, what is that rhythm? Before pills, before gadgets, before complicated routines, just focus on the timing. Have a regular wake time on weekends. Morning light in the light on the back of the eyes in the morning is fantastic for helping galvanize the melatonin or orexin cycles to get into a normal rhythm. Avoid bright light at the end of the evening. Again, if you've got a phone, turn on the blue light filter. The brain's not meant to see bright blue light at 11 p.m. Sleep and meals should be reasonably predictable. If the body's digesting very late in the evening, you're going to be upset. You're going to have heartburn, GERD. Someone's going to start you on a PPI, and then you're going to have a B12 deficiency. So again, just eat a little bit earlier, 6, 7 p.m. The brain sleeps best when you know what's going to sleep. We're all children on the inside, and kids have a better time if they go to bed at a reasonable time at the same time most nights. So just treat yourself like we all are kids in this world. Better sleep is driven by better sleep drive. This evolved as a balance of activation and restoration. If you want to build good sleep drive, physical activity does the most. Daylight anchors, like we mentioned, help the body maintain that solid circadian rhythm, and consistent timing lowers the energy necessary to get into that sleep period. Again, if you have that melatonin and you need to take melatonin, make sure you take it at the same time every night, and ideally somewhere between 8 to 9, because that's when your melatonin cycle begins to peak. And if you're at the peak, you're able to get into the sleep. Also allow the brain time to disengage. Again, the sleep is a function of activation and suppression. And if you reduce stimulation at the appropriate time, caffeine, screens, general conflict, you're going to make it easier to go into that period of that cycle. Quiet routines in the end of the day signal safety. Remember, we're trying to be safe. We're still, in a world that, it's dangerous, even if we're not thinking about it. Breathing, mindfulness, gentle stretching, and cooling. Again, bathing, hot. Some people are stimulated by bathing or showers, but overall, the vast majority of us, if you get warm heat by the end of the day, whether or not that's a sauna or a bath, the body will naturally cool as a consequence. If the body begins to cool, that's that intrinsic signal from back when we were mammals underground, telling us now it's time to go to bed. Again, we're still mammals. We still live in a dangerous world, and there's a part of us that is always going to be a little hyper-vigilant about our environment. So what do you need to do? You need to create a safe sleep environment. It sounds weird in this modern world, but the brain is still a brain, and we still have a primitive, certain aspects of ourselves are still very primitive. Mammals needed protected environments to fully power down, which means having a dedicated sleep space and just for sleep. That means don't be in your bed on an iPhone all night long. Sleep is for one thing only, sleeping. Don't do anything else there. No eating, no playing, nothing like that. Cool environment. We evolved to sleep underground. So sometimes dropping your core body temperature helps. Darkness. We're supposed to sleep in the dark. Enable circadian rhythms. Blackout screens if necessary or curtains. Reduce sensory input. Microarousals as possible. Late night stimulation, like we mentioned. Again, the goal is to not be in alert mode. Don't watch, The Walking Dead right before you go to sleep. And of course, physical containment. Again, we talk about things that, again, the world's a scary place. And having a supportive bedroom, a firm mattress, a weighted blanket gives you a sense of being hugged or being in a burrow. Because again, we're still primitive creatures. So when sleep doesn't improve, you got to look a little deeper. Sleep stays fragmented. It's not just bad sleep. Don't ignore it. It's often a signal. First, before you treat with medications, make sure there's nothing medical going on. Breathing issues, COPD, OSA, medication side effects are very common. Mood and stress, a big issue. Chronic pain, even bigger than that. And of course, easy to treat circadian rhythms. If sleep isn't improving, don't just treat the side effects. Ask why and go a little deeper. Now that said, sometimes, even after treating the medical illness or improving as much as we can, you still can't get that deep restful sleep, so people will talk about medication choices. And I want to stress here, sedation does not mean restoration. Just because you're knocked out doesn't mean you're restoring the brain. That's the purpose of sleep. So don't chase unconsciousness. We're looking for organized sleep. Some medications help, most don't. Some sleep medications make things much worse. We know chronic alcohol, anticholinergic, antihistamine not only make you foggy the next day, they also increase the risk of cognitive impairment the longer you take them. So again, there's a risk there if you're taking these things that are over the counter. Over-sedation increases the risks of falls, hypoxia, and next-day cognitive impairment. And if you combine these medications with an untreated medical condition like obstructive sleep apnea, this accelerates cognitive impairment. So again, the target is restorative sleep, not just sedation. If you feel you need for a sleep aid, make sure you haven't missed something before you add something. If you do need something, talk to your neurologist or primary care physician. Melatonin, Rameltein. Melatonin, we need it for our circadian rhythms. Rameltein is just an agonist of the actual melatonin receptor, so same pathophysiology. And DORAs, that's acting on orexin. We evolved it to maintain stimulation. If you suppress it, less stimulation. So it's piggybacking the natural systems that we've always had to maintain deep restful sleep. You can use in situations trazodone, gabapentin, doxepin, not my first line agent because it's not piggybacking your natural rhythm, but they have some limited evidence for maintaining sleep architecture. So again, thing to take away from today. Protect, rest, protect the brain. Longevity is not possible without restoration. It's necessary to repair, not through just deep sleep, but also glymphatic clearance. You have to enter into restoration by effectively controlling your breathing, managing your heat, and relaxing. And of course, supportive states, quiet wakefulness, calming yourself before you go into it, and creating a low demanding environment. If we want to preserve our brain, we have to protect time to recover. So those are the references. Thank you for the team for whom this would not be possible without.
Thank you, Dr. Rini. For those of you who knew James before today, you also knew that he could catch up the talk to do an hour and a half in 20 minutes. We learned a lot. I'm reassured that the reason that I do sleep so well in a cold room is that I'm really just a mammal trying to hide underground from predators. I've got 2 teenage boys. I think I know who the predators are.